Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Vulvar cancer. Introduction. Vulvar cancer affects the vulva, the external part of a woman's genitals. Worldwide, nearly 27,000 women are diagnosed with vulvar cancer each year. The earlier vulvar cancer is detected and treated, the more likely are the chances of a successful treatment. This program will help you better understand what vulvar cancer is and what treatment options are available. The vulva. The vulva is the external female sex organs. It includes the vaginal lips, clitoris, and the openings to the vagina and urethra. There are two sets of vaginal lips, the labia majora and the labia minora. The labia majora are the outer lips of the vulva. The labia minora are the inner lips of the vulva. The clitoris is sensitive tissue found between the vaginal lips. It is located at the top of the inner lips. The hood is tissue that partly hides the clitoris. The openings to the vagina and urethra are also part of the vulva. They open into an area called the vestibule within the inner lips. Inside the vestibule are glands. These glands release substances for lubrication. Behind the vaginal opening is the anus. The anus is the opening of the rectum to the outside of the body. The area that connects the openings of the vagina and anus is called the perineum. Vulvar cancer. The body is made up of very small cells. Normal cells in the body grow and die in a controlled way. Sometimes cells keep dividing and growing in an uncontrolled way, causing an abnormal growth called a tumor. If the tumor does not invade nearby tissues and body parts, it is called a benign tumor or non-cancerous growth. Benign tumors are usually not life-threatening. If the tumor invades nearby tissues and body parts, it is called a malignant tumor or cancer. Cancerous cells spread to different parts of the body through blood vessels and lymph channels. Lymph is a clear fluid produced by the body that drains waste from cells. It travels through special vessels and bean-shaped structures called lymph nodes. Cancer that moves from one tissue to other body parts is known as metastatic cancer. For instance, a vulvar tumor may grow through nearby tissue and lymph nodes over time. Cancers in the body are given names, depending on where the cancer started. Cancer that begins in the vulva will always be called vulvar cancer, even if it spreads to other places. Vulvar cancer most often affects the outer vaginal lips. Less often, cancer affects the inner vaginal lips or the clitoris.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Risk factors. It is usually impossible to specify the cause of cancer in an individual patient. However, we do know what causes cancer in general. Doctors also know factors that can increase the chances of getting cancer. These are known as risk factors. Age is a risk factor for vulvar cancer. Women older than 45 had the highest risk for developing vulvar cancer. Another risk factor for vulvar cancer is having human papillomavirus or HPV infection. HPV is a type of virus that can cause abnormal tissue growth and other changes to cells. HPV also plays a role in other cancers, such as cervical and vaginal cancer. Not everybody who has risk factors for vulvar cancer develops vulvar cancer. Some people who have no risk factors for vulvar cancer can still develop the cancer. Symptoms. Vulvar cancer often does not cause early symptoms. This makes it difficult to detect vulvar cancer early. Some women do monthly vulvar self-exams to check for any changes. Regular vulvar self-exams can help you learn what is normal and what could be a sign of a problem. A woman may notice symptoms earlier if she does a regular vulvar self-exam. Common symptoms of vulvar cancer are a lump in the vulva, itching that does not go away in the vulvar area, bleeding not related to menstruation, tenderness in the vulvar area. If you notice any of these symptoms, talk to your healthcare provider. These symptoms may or may not be caused by vulvar cancer, making it necessary to see a doctor to find out what is causing your symptoms. Diagnosis. If you have the symptoms of vulvar cancer, your doctor will try and find out if vulvar cancer is the cause of your symptoms or if there is another cause. Your doctor will ask you about your family medical history in addition to your own. You may also have blood tests or other lab tests to rule out other causes of your symptoms. A physical exam will also be performed. This includes checking the vulva for any signs of disease. If the skin of the vulva looks abnormal, or if a lump is found, a biopsy may be done. A biopsy is the removal of cells or tissues so they can be viewed under a microscope. It is the only sure way to know if cancer cells are present. Staging. If you have vulvar cancer, your doctor will determine the stage of the cancer. Staging is an attempt to find out if the cancer has spread and, if so, to which parts of the body. Stages are usually described using the numbers 1 through 4. A lower number indicates an earlier stage. Staging is helpful in deciding the best course of treatment. When staging vulvar cancer, doctors want to find out how deeply the cancer invades the tissue of the vulva, whether the cancer invades nearby tissues, whether the cancer has spread, and if so, to what parts of the body. If vulvar cancer spreads to nearby lymph nodes, it can spread to other areas of the body. When cancer cells break away from the tumor, they can travel to other areas of the body through the lymph system. Vulvar cancer can spread to other lymph nodes, organs, or bone in this way. A pelvic exam may be done to check for lumps or changes in the internal female reproductive organs. This can help determine if vulvar cancer has spread to these organs. A colposcopy may also be done to stage vulvar cancer. During this procedure, a lighted magnified instrument is used to check the vagina and cervix for abnormal areas. Tissue samples may also be taken. Another test that may be done is a cystoscopy. A cystoscopy uses a thin, lighted tube to look inside the bladder and urethra. Tissue samples may be taken. To check the rectum and anus for abnormal areas, a proctoscopy may be performed. A thin, lighted tube is inserted into the anus and rectum during a proctoscopy. Tissue samples may also be taken. X-rays of the chest and pelvis may also be used to stage vulvar cancer. An X-ray is a type of high-energy radiation that can go through the body and onto film, making a picture. An intravenous pyelogram, or IVP, is a series of X-rays of the kidneys, ureters, and bladder to see if the cancer has spread to these organs. A contrast dye is used to see if there are any blockages. Other imaging tests may also be done. These include a CT scan or MRI. A PET scan can also show if vulvar cancer has spread elsewhere in the body. For this test, you are injected with a small and safe amount of radioactive sugar. PET scan stands for positron emission tomography. The PET scanner makes a picture of the places in your body where the sugar is being taken up. Cancer cells show up brighter because they use sugar faster than normal cells. Sometimes staging is not complete until after surgery to remove the tumor and nearby lymph nodes. Treatment and supportive care. The type of treatment used depends on the stage of cancer as well as the patient's age and general health. Treatment for vulvar cancer may include surgery, chemotherapy, radiation therapy, laser therapy. Some combination of these treatments may also be used. Surgery is the most common treatment for cancer of the vulva. The goal of surgery is to remove all the cancer without any loss of the woman's sexual function. Many different types of surgery are available. Chemotherapy is the use of drugs to kill cancer cells. Chemotherapy is usually taken by mouth or injected into a vein or muscle. Radiation therapy uses high-energy rays to kill cancer cells and stop them from growing and spreading. The radiation that treats the cells comes from a machine that aims the rays at a specific area of the body. Another type of radiation uses radioactive liquids to treat specific areas. The doctor places radioactive needles, seeds, wires, or catheters that contain the radioactive liquid directly into or near the cancer. This is known as internal radiation. Chemotherapy and radiation therapy may sometimes be done together. These treatments may also be used on their own, before surgery or after surgery. Laser surgery is also a treatment option for vulvar cancer. Laser surgery uses a laser beam to kill cancer cells. There may be clinical trials available for people with vulvar cancer. Clinical trials test new medical approaches and treatments. Vulvar cancer and its treatment can lead to other health problems. It is important to have supportive care before, during, and after cancer treatment. Supportive care is treatment to control symptoms, to relieve the side effects of therapy, and to help you cope with emotions. Supportive care also deals with the pain associated with cancer and its treatments. Your healthcare provider or a pain control specialist can suggest ways to relieve or reduce pain.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Vulvar cancer affects the vulva, the external part of a woman's genitals. Worldwide, nearly 27,000 women are diagnosed with vulvar cancer each year. Vulvar cancer most often affects the outer vaginal lips. Less often, cancer affects the inner vaginal lips or the clitoris. The cancer may invade more deeply into the vulva and nearby tissues over time. Treatment for vulvar cancer may include surgery, chemotherapy, radiation therapy, laser therapy. Some combination of these treatments may also be used. Vulvar cancer is most treatable in its early stages. Research already has led to advances that have helped people live longer, and research continues to find better ways to care for people with vulvar cancer.
Thank you for using Explain.